And we're heading off to the Health Hub Times Square in Ballincollig, where Anneliese joins me. Good afternoon to you, Anneliese.
Good afternoon, Patricia.
And we can all get a bit of vitamin D this week because the sun is going to be shining.
And it's glorious here in Ballincollig. I don't know what it's like with you, but I can't even see a cloud.
Yeah, I've been saying it all morning. I'm looking out at a blue sky, and there's nothing for lifting the spirit like looking out at a clear blue sky. It really is great. Okay, straight into questions. Now, somebody got in a question nice and early this morning, and so I want to get to that one first. Hi, Patricia. I'm in early with my question for Anneliese, please. I'm suffering with anxiety, nervousness, panic, feeling weak as if I'm going to faint. I have neck pain. Now, I have had a checkup with the doctors. All okay. They've checked bloods, blood pressure, etc. But I am menopausal. Are these symptoms of the menopause, or am I simply going mad? Please help. What would you recommend? God help.
Yeah, and it is actually a big part of menopause, Patricia, because in actual fact, the building blocks for our sex hormones and our stress hormones are made of the same building blocks. In actual fact, they're made from cholesterol as one of the precursors. And for a long time, what was happening about 5 years ago, I was seeing women coming in, and they'd had this feeling of anxiety. They were going to their doctors, and they were being given antidepressants and high cholesterol tablets because the cholesterol was elevated because the body tries to make more. And then the cholesterol tablets actually made them more anxious. So that's the first thing I would suggest here is, have you been put on a cholesterol medication? Because it can make everything worse. And if you have, maybe that's part of the problem. Then otherwise, there's a couple of things that work really well. And I'm not sure if HRT is applicable in this case. A lot of people can't or don't want to take the synthetic HRT. But you can take plant-based HRT. And then a lot of the natural menopause supplements have lots of things in there for anxiety, because it's a common one, and for low mood, because that's a common one, and for stress, because most of us are living very busy lives. So I think the first thing I would recommend for this lady is the Nutri-Advanced Mega Mag perimenopause support. So that's got herbs in there like ashwagandha and rhodiola for anxiety and stress. It's got vitamin B6 in there, which is really good for the low mood anxiety that comes with hormone imbalance. It's got plant-based hormones in there, and it's got stuff there for supporting you for hot flushes and some lovely B vitamins for energy and brain as well. So I think that would be a great place to start. So it's the Nutri-Advanced perimenopause support. It's brilliant. And then if you needed additional support for anxiety, there are a couple of things that work very well in the moment to make you feel better. And one of them is something called L-theanine. It's safe to take with most medications, and it can help promote calm and focus very, very quickly. And the other thing then is CBD oil, which is cannabis oil, but it has absolutely none of the THC hallucinatory in there. So these are things you can take if you're having a bad day, and within 15 minutes it'll sort of make that jittery, anxious, panicky feeling go away. And I think with the lady's neck as well, I'd say there's a tie in there, Patricia, because if you're anxious, you're tense, and all the muscles up into the neck and the head are horrible,
But God help her to think, or am I going mad? You're not the first woman to head into menopause and say words like that you actually think, because you go to the doctor, they can't find anything wrong, and you think, oh my God, it's all in my head, I must be going mad. You're not.
But it is, and there's other things as well, Patricia, that we are made to feel that we're going mad about. And one of them that I've just recently discovered is like hip problems. Actually, your hip is perfect, but it's tendonitis, so your tendons can become very inflamed in your joints. And that's part of menopause. It goes away with HRT. Movable pain, a lot of people would find that their joints get very sore, but again, it's not arthritis because the pain can move from hand to hand or finger to finger. That can go away with HRT. So it was terrible when I used to see women that had put on cholesterol tablets, then having to go on antidepressants, and really all they needed was HRT. So thank God they've started giving it back to women again.
Yeah, and I suppose as well, we've got some brilliant GPs, and we've got some brilliant female GPs. I always think and this is not in any way to knock the male GPs, but I think for women to try and find a really good GP who understands menopause.
Absolutely, and someone a bit older as well, because even younger women don't really understand menopause. So somebody who's been through it themselves is always the best person to get sympathy for.
Yeah.
But I do think now, to be fair, that most doctors have started recommending HRT.
There was
a big issue about it, you see, with cancer before, Patricia.
And that was all debunked.
Well, the study was debunked. Now, there is an increased risk of cancer, but it's very, very small. So you have many, many years of a better life because you don't feel so horrible. Your bones are better, so you have far less chance of osteoporosis, and there's the most tiny risk of a cancer. So if you come from a family that doesn't have history of breast and cervical cancer, it's definitely risk versus benefit. It's a fantastic trade-off.
Yeah, 100%. Okay. Hi. Good morning, Patricia. Question, please, for Anneliese. I've been diagnosed as having 2 gallstones. Could you recommend something for me to take? I'm currently on aspirin, a blood pressure tablet and a statin. What could I take to help to relieve the pain of the gallstones?
Okay, so you see, the problem with natural approach, Patricia, is that it doesn't really have much in terms of the pain killing. Immediate pain killing is more about dealing with the problem. So there are things that can soften out gallstones. The first one that I would recommend is something called malic acid. It actually comes from apples, so you could drink a couple of litres of apple juice every day, or you could get the malic acid. I know that Viridian do a blend of it. And that's very good to soften gallstones, and sometimes they can pass naturally themselves. The other thing then I would definitely recommend is a digestive enzyme that's got a lot of fat digesting enzymes in there, because if your gallstones are acting up, you will probably find that eating anything fatty makes you very, very sick and gives you that terrible pain. So BioCare do a fantastic artichoke and lipase complex, and that is brilliant to take if you're having a meal where you have meat or anything in there that might be slightly fatty. I'd say try and avoid fat for the time being as well. And then the last thing I'd recommend, and it's not really, again, a short-term solution, but it might help with the long-term, is there's a company called BioNutri, and they have a very good gallbladder support product called Taracyn, Taracyn. So it's very good to help prevent gallstones, to flush sludge from the gallbladder as well, because that's sometimes a problem, and to support bile production, and there's some natural anti-inflammatory in there as well. So it's very good in the long term. But if you're in active pain from gallstones, I don't know, will any of those give you very quick relief?
Yeah, because somebody is saying, get it out. The pain is absolutely awful. And I'm assuming that somebody's speaking from experience.
Yeah, and you know, you can live very well without a gallbladder, and you can support yourself with lots of natural things afterwards as well. So if it does have to come out, don't worry about it. It's keyhole surgery. It tends to be totally problem-free.
Okay. Ellen says, have you any suggestions on preventing and treating a sore throat? We as a family are prone to them in our house. 2 adults, the parents, and then 2 adult children, 21 and a 25-year-old, for example, all in the last 2 weeks ended up on an antibiotic to treat same as we're heading into the winter months. What can they do to try to prevent sore throats, which seems to be the Achilles heel in that family?
Yeah. So I think the couple of things now. The first thing I would definitely recommend is a probiotic, because if everyone's been on antibiotics, it will have killed the good bacteria in the mouth and the gut. So something with Lactobacillus salivarius in there is good, because that one is very good for the mouth and the health of the mouth and throat as well. And I know BioCult, they have that in their probiotic product. Then immune support generally, Patricia, I think is important, because multiple studies have shown that people who suffer worse from COVID or end up in hospital from COVID or even get COVID have had low vitamin D status. So I think supporting your immune system, giving it everything that it needs and arms it against these kind of infections. So the elderberry complex, we sell lots of it every year. There's an adult and a kids one, and that has got your vitamin D, C, zinc, vitamin B6, elderberry extract antiviral, and there's beta-glucans in there which kind of ramp up your first line of defence. So that should be the basic throughout the whole winter. And then we have the Dr. Dealish Clare throat spray. It's got some echinacea in there as well as some marshmallow if your throat is sore. It's a great one. I actually take it on a plane with me because of the echinacea in it. Or if I'm going out in the winter into kind of where I know there's going to be loads of people coughing and spluttering, I take it, and I take a few sprays every now and then just to keep my immune system ramped up and prevent getting sick. So that's absolutely brilliant. You could use it once a day as a preventative, or you could just have it there in your medicine cupboard to use as soon as you feel the slightest tickle of a throat. Start spraying with it. And then, of course, gargling with salt and water daily can work brilliantly as well.
Okay, here's an interesting one. Hi, Patricia. What would Anneliese recommend for my husband to prevent mosquito bites? He is currently taking vitamin B1 and garlic. We're going to Spain, but we're going to be there for 6 weeks. Lucky you. He's a martyr to the mosquito bites. Thanking you. And this never ceases to amaze me, because my husband and Marta, our daughter, we can all be in the one room and the next morning they'll be eaten alive and they just don't touch me. So they're attracted to some people more than others. Is there anything you can take to stop them biting you?
Well, so the B1 and the garlic, they say, can help because it kind of exudes through the skin and they don't like the smell of it.
Okay.
But I'm afraid the only things that really work are the sprays with DEET, D-E-E-T in there. Now, DEET is highly toxic. So you need to make that decision yourself. I suppose if it's only going to be used 6 weeks of the year, and if it prevents, lots of bites and misery, again, that's your risk versus benefit. Now, there's a couple of things that I find work, because I'm one of the people who's the best insect repellent for everybody else. They'll bite me and no one else. I use the Incognito insect repellent spray, and I always bring a bottle of citronella with me, and I put citronella into my sun cream if I'm on the beach, or if I'm putting on body cream at night. I put that in there. They don't really like the smell of that. And then I find the best thing is if you get bitten, don't scratch. If you scratch, they get much worse. So there is two things that work well for that. One is actually just a bit of spit. Put a bit of spit on it, and that for some reason works really well. And if you think about animals, actually, Patricia, if they hurt themselves, that's what they do as well. So there must be obviously something in the saliva. But there's also that Incognito company, they do a kind of a zapper. And I know Kerry, who works here, took that when she went to Thailand. And she said when she got bitten, she'd zap herself with that little thing. And it definitely took the itch out of it. So she wasn't as inclined to scratch. And then the last thing I'd recommend is colloidal silver as a spray, just to prevent them getting infected if you have been scratching. Because it's a great natural kind of antibiotic. So, unfortunately, there's nothing to prevent you from getting bitten. It's about managing it.
Yeah, and actually, we were over in Spain a few years ago, and Marcia, my daughter, got bitten, and of course she was scratching it, and they got infected, and I went into the chemist. Of course, they're great over the counter. I got this fantastic cream. It was an antibiotic and antihistamine cream, and it was like pittance. I think it was about €2. I think every time I go back, I bring in a tube saying, "Can I have another one of those, please?"
Well,
and you just rub that on, and it was great. It sorted it out.
And actually, you can get one here as well called Antisan, Antishan, I think it is, and you get that in the pharmacies here as well, and that's one of those antihistamine creams. Actually, I forgot about that because I do use it when I get bitten by bees. I'm an allergic, and it works brilliantly.
Okay.
So you could try that as well.
Can we just go back to HRT for a moment? Somebody wants to know, is it true that there's a 10-year window of which you can't receive HRT? I'm 66 and I'm still suffering terribly from the sweats and hot flushes.
You see, I truthfully, I don't know the answer to that question, Patricia, and I wonder, different doctors, have they different takes on it anyway? Some doctors would say there's no reason you shouldn't be on HRT for the rest of your lives, and then some doctors say there's no benefit on starting it at, once you're past your 60s. I think if you're still getting symptoms in your 60s, you'd still benefit from HRT. So I think it's about finding a doctor, I suppose, who's got the most up-to-date information. And I know that there's a lot of these menopause hubs, they're called, that have started popping up around the country. There's one here in Ballincollig, and those doctors are completely up to
they specialise.
They're
it's their
specialists,
specialty.
they're medical doctors. So they would be definitely worth a visit, or even a phone call, because they'll tell you over the phone whether or not you're a candidate.
Yeah, because somebody else is saying, Trish, you were right about lady doctors. I was seeing a male doctor with a reoccurring problem for 3.5 years with no relief. My friend suggested try the lady doctor in the practice. I did. Within weeks, she'd sent me for tests and scans, and we're beginning to get the results. She knew what I was going through, because she obviously had been through something similar as well.
Yeah.
Okay, and just very finally, Mary in Charleville is suffering from very bad restless legs. She ended up at 4 a.m. this morning, had to go into an ice cold bath to get some kind of relief. She was in with your shop and she got mega magnesium muscular, but she's wondering how much of it should she be taking?
So the Mega Mag Muscle has lots of things in there for restless legs, and generally you do take 1 scoop tends to be is what's recommended. If she's getting absolutely no benefit from that, there's other things that she could look into. Sometimes if your iron levels are low, you can get that terrible cramping. The other thing I'd suggest as well, and it's free, is actually doing a lot of stretching throughout the day and before you go to bed at night, because that's simple, it's free. You go onto YouTube and just Google in YouTube, do a search for restless leg stretches and lots will come up. And then quinine can also be another solution as well. So drinking the Fever Tree tonic water has natural quinine in there and it's got a good bit in there. So drinking that as well can sometimes help with that restless legs. So the Mega Mag is brilliant. It's got lots of stuff in there, and if it doesn't sort your problem, just taking plain magnesium on its own probably won't. So you might need to look into, like, your doctor's, maybe a proper prescription for quinine tablets.
Okay. All right, we leave it there. Listen, have a lovely weekend. We'll chat again next Monday.
Thanks, Patricia.
Thanks, Anneliese. That's Anneliese Dressel, the Health Hub Times Square in Ballincollig.